Thank you, everybody, for joining us in our virtual session. A big thank you to the 2022 virtual APATS for letting us present on this topic. Um, Hamstring strains have been, I work in the world of track and field, so hamstring strains have been a big bugaboo for us, and, that definitely hits our student athletes hard. So, being able to dive in and, learn about how I would treat how I treat hamstring strains, really led to my motivation to be able to present on what I've learned and, how I go about treating hamstring strains.
So putting this together, Randy reads a lot of research articles. So how many did you use probably for this?
Well into the 20s probably. And this also kind of comes with the accumulation of some of that, clinical experience, what I've done with my hamstring strain patients.
So going off that, we really strive to bring together that evidence and experience. So with the evidence that Randy's synthesized and brought together, we're going to bring in also some clinical experience from both of our experiences at the collegiate level and beyond. Yeah.
Yeah. So if you haven't noticed, I am Randy Harris.
And I'm Sandra Harris. And we also co-host AT Corner Podcast.
So we first would like to start out with we both have no conflicts of interest to report. So the objectives of this presentation is one, we're going to review the muscular anatomy of the posterior thigh and pelvis and how that's going to function while we're sprinting, because at the end of the day, we need to understand what these structures are, where they are, and what's their role in one of the more risky activities when it comes to hamstring strains, and that's actually sprinting. Then we're going to understand the common risk factors associated with hamstring strain injuries. We'll identify effective prevention interventions, understand the consequences of a hamstring strain injury, and then review the management of a hamstring strain injury and the return to play considerations that, as clinicians, we should be considering utilizing in our practice.
So first, as we always like to start with, our anatomy.
Yes, I think it's good to get a nice basis of what exactly these structures are, where they're attaching, what they look like, and what's their relation with other important structures. So when we talk about hamstring strains, you got to talk about the biceps femoris. This is a big one when you talk about hamstring strains, considering it is the long head of the biceps is one of the more common muscles of the hamstring group to be injured in a hamstring strain. So the biceps femoris, the long head's originating off the ischial tuberosity. The short head is coming off of the linea aspera, the lateral aspect of that portion of the femur. It's going to insert into the head of the fibula, LCL, and the lateral tibia, so it has a very broad insertion. And then, of course, we have our medial hamstring, so that's your semimembranosus and your semitendinosus. Again, these are also going to originate from the ischial tuberosity, and then their insertions are going to be a little bit different depending on the muscle you're talking about. So the semitendinosus is going to insert into the pes anserine, so kind of going into that anteromedial tibia. And then also the semimembranosus, which is going into the medial tibial condyle and the oblique ligament of the knee. And of course, we can't talk about hamstring strains without also including the adductor magnus. The reason adductor magnus is important is because if you look at where it originates, right, it has pubic symphysis, but then or pubic ramus, apologize, but you also start seeing those ischial attachments like the ischial ramus and again the ischial tuberosity. And then it'll also insert into the linea aspera and the adductor tubercle. The reason that linea aspera is important is because it shows that it does have a little bit of an extension moment, whereas we know the secondary function of the hamstrings is a hip extender. So I've seen it before. You treat hamstring, and you have an athlete that's just plateaued, not getting better, and you focused on the hamstrings. The adductor magnus is a great differential if you have someone who's just not responding to your normal hamstring rehab or treatments. Hey, let's start thinking the adductors. Let's start thinking about adductor magnus. And I think it's important to highlight, if you notice, all three of these muscles, or all four of these muscles, both have some kind of connection to the ischial tuberosity, which means all of them are going to have some kind of connection to each other. So biceps femoris can definitely have an effect on adductor magnus, and vice versa. If there's tension in the adductor magnus, it could be applying tension to that biceps femoris origin as well, which is then going to affect how it functions.
So now we've gone over the anatomy, why don't we move a little bit more into the actual function and the biomechanics?
Yes, the actual function behind this anatomy and what exactly it's doing during running. So, as we know, the phases of gait are broken down into a swing phase and a stance phase. In running, obviously, that's a little bit different. That swing phase is pretty huge, and that stance phase is very small. So we really want to highlight the swing phase, as this is the area where most hamstring strains are going to occur. So the swing phase is characterized by that extreme hip flexion and that knee extension. During this phase in gait, the hamstrings are responsible for decelerating that knee extension. Semitendinosus has a large activation throughout the entire swing phase, whereas that biceps femoris activates once you get towards the middle and that late swing phase. So keep this in mind a little bit later as we kind of talk about the impact of what an injury does, because this is going to be important as we talk about the motor control of the hamstrings.
And I assume also the treatment strategies.
Absolutely.
And when to target each muscle.
Absolutely. Of course, the hamstrings aren't the only things that are working here because, again, one of the motions that we just talked about is the hip flexion. So the glute max is also responsible for decelerating that hip flexion. But with the hamstrings being a secondary hip extensor, you can see there could be a dual role for these hamstrings, which they get a lot of load throughout that swing phase of gait.
Okay, so risk factors, I know that this is something that we talk about on our podcast, but risk factors are important for the fact that, you kind of want to know what can cause this sort of injury. However, I do want to let you guys know, if you guys have not listened to some of the things that we've talked about before, when we're talking about risk factors, we're mostly focusing not just on preventing injury, because obviously it would be great to prevent every injury, but that's not likely, right? So we really look at the risk factors as one, a treatment strategy, and then also looking at preventing further injury or secondary injury. After someone comes back from a hamstring strain injury, what can we target those risk factors that maybe cause them to have it in the first place? Can we prevent them from re-straining this hamstring?
Absolutely.
So go ahead.
Yes, so going into these risk factors, one of the first thing that the literature always looks at, because it's really easy to test, is strength. So does having a strength deficit in the hamstring group put you at risk for a hamstring strain injury? And a lot of people kind of like to jump to, oh yeah, for sure, definitely. But the actual evidence for this is pretty limited. There's not a lot of strong evidence that says if you have weak hamstrings, you are going to strain your hamstring, right? It's a lot of the studies that have found it, it's kind of a weak association. It's just nothing's really like strong. And I think the reason that you see this, and I know I've mentioned it before on the podcast, is when you're testing strength, you're testing one moment at like a max ability, like how much force can this muscle group produce? And I don't think that gives you a great profile of the function of the hamstrings, of understanding who's at risk of an injury, because strength doesn't take into account the motor control, and it also doesn't take into account the accumulation of load. Our athletes aren't just doing one run and that's it, right? They just do one quick sprint and, oh, well, we're done, right? They're doing these movements multiple times throughout the year, not let alone a single practice. So testing strength, I think that's where you get a lot of the limited evidence on how valuable strength is. And this kind of goes to glute strength as well. There's not a lot of great studies that have looked at glute strength and the risk of hamstring strains. So I would say there might be an association, probably pretty similar to hamstrings, where, glute strength has like maybe a weak association with, like, if you have weak glutes, you're probably going to get a hamstring strain. I think what we need to do is start looking at more the deficits in motor control, because I think the motor control aspect of how we activate and how we function between these two muscles is really where we're going to find that risk of injury as opposed to just strength in general.
So if I could make this analogy, and correct me if I'm wrong, but I'm thinking when you're talking about this strength, looking at hamstring strength is kind of similar to talking about concussion when, yes, we know that a single impact can cause a concussion, but also we know that there are subconcussive impacts that can cause a concussion, like multiple of those. So I was also thinking while you were talking about that, that evidence might not be taking into consideration these substraining impacts.
Yes, absolutely. Because if you have poor motor control, right, if you're activating those hamstrings more than you would the glute max compared to someone who would normally have a better activation pattern, okay, yeah, one movement, that's fine. But the accumulation of like sprints, I mean, we see the track kids. First of all, we all know our track kids, they don't like to stop. They're always training, they're always running. Well, they're just accumulating this poor motor pattern, and eventually something's got to give, and it's probably going to be that overloaded muscle, and that's where you see the strain. And that's why I think strength isn't the best indicator. Now, I'm not saying like, oh, that's it.
Just throw it out.
Yep, throw it out. We're never strength testing our kids. No, it does give you information, especially if you're trying to identify asymmetries. Like that could be some valuable information as well. I just don't think we need to put all our eggs in, oh, well, we're going to test strength and we will prevent all hamstring strain injuries.
Right.
And I think some of that also kind of goes into the next one is looking at those kinematics. They found that those that went on to get a hamstring strain or sustain a hamstring strain had a higher anterior pelvic tilt. So you're starting to see, with that anterior pelvic tilt, we already talked about all these muscles originate from that posterior chain. So now if you put them into an anterior tilt, you're already starting that tension. Well, if you look at the biomechanics of gait and there's in sprinting, right, you see a lot of hip flexion, you see a lot of knee extension. So the hamstrings already have to have a lot of extensibility throughout a normal motion. So putting an anterior pelvic tilt to begin with as your baseline of movement, that's already putting an increased strain on them.
Well, and considering a lot of that movement is slowing down or eccentric movement.
Yes.
Which is a lot of load on that tissue.
Yes, a lot of lengthening. They also found that those with an increased lateral excursion of the torso went on to sustain a hamstring strain injury. So what that means is essentially when they were running, when the subjects were running, they had an increase of just their trunk going side to side. And I think this really highlights the importance of core control in preventing or treating hamstring strain injuries. And this has been shown in plenty of studies that have used mostly core functioning or core strengthening, which in their core strengthening, they also included glutes as well, as a way to treat and prevent hamstring strain injuries, and have found very good results without actually focusing on just strengthening hamstrings. So it just shows you how important core control is to protecting the hamstrings. And then the next one that I think is very important to consider is muscular endurance. So one good study that looked at the single leg bridge test score, which in the picture below is kind of a demonstration of the exercise. What they essentially did is they had them do this exercise where they did a single leg bridge in this formation as many times as they could until fatigue. And those that scored, I believe it was under 19 reps, had a higher chance of getting a hamstring strain injury compared to those that had higher values. So again, this kind of goes into what we were talking about strength. Like, okay, maybe that one rep, they had okay strength, not too bad, but that repetitive motion, right? They weren't able to sustain the same amount of force. So I think muscular endurance should definitely be looked at, and it kind of ties into monitoring of fatigue and training load, right? If you have someone who has a lower amount of endurance in that hamstring group, well, they're not going to make it very long in a game or throughout the season, right? Because we already know going through a season, this has been seen in like shoulders and like other muscle groups, that going through a season, you start to see a decrease in strength just because of the fatigue and everything. So if you're already starting with a low bar for endurance, you're going to lose that a lot more than someone who has a little bit of higher threshold. So I definitely think endurance should be looked at as well. And of course, as with any musculoskeletal injury, previous injury is a huge risk factor, especially for hamstring strains. And you've probably seen it in your own practice, right? The kid that sustains a hamstring strain or the kid that you have coming in who's had them before is probably going to have some hamstring complaint. So keep that in mind as we talk about the treatment, because there are definitely reasons behind why we probably see such a huge risk of re-injury in those that have already had a hamstring strain. So keep that in mind as we go on through this presentation.
I always explain a previous injury as, especially in a muscle, it's like when you have a piece of paper and you tear that piece of paper and you can get it wet and you can kind of like put those fibers back together, but it's still not, you can tell where it was reformed, because your body's really, if they're like 18, 19, 20, your body's taken 18, 19, 20 years to get to that point. And, you know, once you strain that or disrupt where that hamstring fibers were, you know, it's going to take time to get back to even resemble what you had built over those.
Absolutely. There's that portion of it, and then there's the portion that your body recognizes that this is, you know, this area is the issue, and it's going to try and adjust to try and protect you.
So now that we talked about risk factors, why don't we kind of stay along the same lines and talk about prevention?
Yes. So anytime you, like, if you're going to type into like PubMed or like Google Scholar and you want to know about hamstring injury prevention, the first thing that's always going to pop up is eccentric strengthening. And most studies look at the Nordic hamstring curl. And this is great exercise, a lot of great results with programs that implemented this exercise as a prevention. I mean, you see studies have shown about a 50 to 70% reduction of hamstring injuries, and those are great results. But I do believe there should be a caveat to this, and one is the compliance is very key. You know, being able to actually execute this exercise consistently is where you get a lot of value. The only problem is, one, this is a really tough exercise to do. You know, not a lot of athletes like doing it. It's really tough, gets them really sore sometimes depending on their strength level to begin with. So you definitely keep that in mind with your student athletes. And also you do have to try and find a time to work it in as well. When, you know, is it going to take time at the beginning of practice? Should I wait to the end of practice? So definitely keep that in mind. Compliance is going to be key in actually seeing these effective results with the Nordic hamstring curl. And I think eccentric strengthening in general is beneficial, not just from the strength aspect, but there's a lot of good research, especially looking at ACL recovery and how important eccentric exercise is to changing the motor system. And again, we've talked about strength necessarily isn't the 100% issue. It's also a motor control thing that I think that we really need to start hitting. So if you can hit that motor system, get it to adjust and adapt appropriately, that's where you're going to see a lot of these benefits, especially from eccentric strengthening. Another thing that I'd caution with the Nordic hamstring curl is, if you notice, it's a bilateral exercise, right? You're using both hamstrings to execute the movement. It doesn't take into account any unilateral deficit. So if you see someone who maybe, like if you are strength testing and you see an asymmetry, this exercise may not help with that asymmetry. It just might just keep it there. So I think it's a good idea to also consider maybe starting with single leg exercises so you can correct any asymmetries and then go into your bilateral exercises.
That's a really good point. I feel like we talk about that a lot with the upper extremity, but we don't really talk about like individualizing the lower extremity as much.
Yes, absolutely. And again, like you look at this exercise and you think, oh, Nordic hamstring curl, that's awesome, that's great, we need to be doing it. But also consider that, you know, a lot of the stuff we do isn't bilateral. You know, we do have to function in a unilateral aspect. So making sure that, hey, first let's get a good unilateral base and then go into those bilateral, I think would be beneficial. And again, like we talked about it in the risk factor, right? We already talked about how anterior pelvic tilt's going to be a problem, that trunk going all over the place, you know, laterally, core strengthening and activation. There is evidence that show just a lumbopelvic prevention program has lowered hamstring strain injury rates. They didn't even do anything with the hamstrings and they actually saw a decrease. So it just shows the importance of the glutes and the core and actually protecting the hamstrings. And again, it all goes off the idea that you're really protecting that base. You're protecting that bowl, which is the pelvis, which all these muscles from the lower extremity are attaching to, right? We already talked about how biceps femoris, semitendinosus, semimembranosus, adductor magnus, all are attaching to that ischium. If you're able to control that, you're able to take a lot less tension onto the hamstrings, and there's evidence that show having good core contraction, good core stability actually improves the force production of these distal muscles. So definitely utilize those glutes. They're very important to protect the hamstrings.
So a couple of good points in here. The fact that it's not just core strengthening, but also specifically core activation, because someone could have a really strong core, but if they're not activating it to control that pelvis, so you are working in the optimal length of that hamstring, so you aren't working in that, anterior pelvic tilt. Again, you can have a really strong core and you can still have an anterior pelvic tilt because you're just not activating it when you need to.
And good.
And then also sneak peeking into the treatment strategies. Like you said, none of this necessarily involves the hamstrings themselves. So when people are first initially injured with a hamstring injury and you don't really want to target that because they're still in acute pain or whatever you're seeing with that patient, you can still target the core. You can still target the glutes.
Yes, absolutely. And I think that's important to talk about is, again, motor control, not just raw strength, not just being able to produce the most force possible. It's the ability to control how much force you're producing and control joints during movement and control that stability. The next thing that to consider in your prevention program is strength endurance. So like we talked about in that single leg endurance test, right? If you start working your exercises towards strength endurance, you actually see less of a strength decline with fatigue. So what that means is someone who, doesn't have good strength endurance, their decrease in strength was a lot sharper than someone who had good strength endurance. So, keep that in mind, right? We start to see hamstring strains or, other injuries, usually later in the game, later in the season, right? So if you're able to focus on this strength endurance, right, you're giving them a much larger threshold for them to lose strength without it being pathological, without it being putting them at risk. And I think that also goes into how you program your prevention program. There's a lot of debate on, should I do it for my warm-up or should I do it, right after practice? And I think it depends on what you're going for. And I think this is where a lot of the programming comes from, is the studies that have looked at doing a hamstring protocol after practice or after a workout shows you gain a lot of strength endurance, but you don't gain as much strength as if you did it before. So I think that's where you got to kind of understand where you are on the season. Okay, if it's early on, maybe I'm prioritizing, the strength aspect, get them as strong as possible, and then maybe next month we'll start working on the strength endurance and we'll transition. So keep that in mind as you program. There's not a right or wrong answer. It just depends on what your goal is. And I say utilize both. Just go into your programming a little bit. And then I'd say overall, a good training load management will also help prevent these injuries, right? It's always really tough to be able to analyze training load, especially if you don't have a lot of equipment. But I think just keep an eye on your athletes. If they got crushed yesterday, with an intense workout, well, maybe we shouldn't crush them tomorrow, or, maybe we should give them a day or so. So keep that in mind, right? Training load management is going to be huge in actually preventing these injuries. Because again, we already know fatigue can cause a lot of decreases in strength. And if you see a lot of decreases in strength while also increasing that load, something's going to give at some point.
So we shouldn't do a bunch of Nordic hamstring curls right before a game?
Yeah, I would not recommend that, or especially before a hard day.
Right. Okay, now we talked about before. Now we're going to talk about what happens after injury.
Yes, as we've mentioned before, it would be great to prevent all injuries, 100% of the time, but unfortunately that's still not the reality. We're just not there yet. Injuries are going to happen. So what exactly happens after a hamstring injury? Obviously, we already know from our schooling and everything, and I know it's a little bit different now than I believe they broke it into 4 phases, but I'm a little old school still. It's easier for me to remember the 3 stages, right? Your inflammation, the inflammation phase beginning, right? The initial injury happens. We have our inflammatory mediators getting there, cleaning up, signaling the rest of the phases of healing. Then you break into your proliferation phases. You're getting those fibroblasts there. We're starting to lay down some collagen, and then we'll start transitioning to more stronger collagen and then into that maturation phase. This happens with any musculoskeletal injury, right? This is happening in the hamstrings during their injury. But now what do we do about pain? And why is the pain aspect that comes with these phases of healing such a big deal? And I think it goes into what's called the new pain theory. And this was a great article that we read when I was in undergrad. It changed my world about how I treat musculoskeletal pain. And it really, I think, ties in very well to why we see such a high re-injury rate on so many different musculoskeletal injuries. So essentially, what the new pain theory states is that when someone's in pain, essentially the entire motor system changes. You see the coordination within a muscle and between muscles becomes altered. You start to see, the activation of these muscles are beginning to be altered. And this is all in the aspect of that short-term protection, right? Your body's trying to protect this muscle or protect this ligament, protect this tendon from further pain, further damage. The problem is we continue to move in this fashion, and now you get the long-term consequence of this becomes your motor pattern. So how does this apply to a hamstring strain? Well, the change in that coordination, you see a more symmetrical activation between the semitendinosus and the biceps femoris. Now, when we were talking about the gait cycle, that semitendinosus actually should be pretty active, and it should have larger activations for a longer time compared to your biceps femoris. But if you're starting to see them have that same activation level, that's a problem. It either means that semitendinosus is getting underactive, or biceps femoris may be way overactive, which means it's going to fatigue faster. Boom, there's your injury right there. Studies have also shown that after hamstring strain injury, the hamstring group in general shows lower activation. You see a lower rate of force development from a previous hamstring strain injury, so they're not able to produce force quickly, which, we see how fast our athletes are running, especially when you're talking about track athletes, right? They're moving really quick. Your muscles have to produce a lot of force really quickly to control those motions and to remain powerful and creating high performance. So if you're losing that, these muscles are just getting pulled and having a lot of tension as they're trying to do their job without being able to produce a lot of force quickly. And then same thing as with the risk factors, the kinematics are definitely different in those who have hamstring strain injury. They do show a higher anterior pelvic tilt. So even though it's supposed to be protecting the muscle, because those muscles can't fire correctly, they're losing that posterior pelvic tilt to go into more anterior, only adding to the strain that's being applied.
The cycle keeps going and going.
Exactly, and this is why, even for risk factors, but even going into after injury, what we do as clinicians with our rehab, obviously there's a lot of, aligning the collagen, creating a nice environment for healing to occur within the muscle. But a lot of what our rehab does and what we try to do is we're essentially just retraining that motor system to fire in a more optimal manner.
One of my favorite parts. So now what?
Yes, so now what? And now it's time to do the treatment.
So for treatment, essentially one of the biggest things, like Randy was just talking about, we want to control pain. I don't think I need to beat a dead horse and keep talking about why we need to control pain after we just had that great explanation. But how do we do these things? Soft tissue work is a big one. I know by setting, sometimes it's a little bit more difficult to get in there, but if you are in a setting that you are able to really work on those tissues, you want to start mobilizing that scarring and connective tissue. Also working, sometimes I like to work if someone's having pain like in the muscle belly. There's a lot of work you can do in the tendon, either near the ischial tuberosity or down distal. You can start working on areas that aren't in that pain, because remember, it's all connected. So if you're working on one area, it will work its way up, and as you start to control that pain, you're going to be able to actually mobilize areas that you're going to want to actually start working on. And then also stretching. There's a lot of different ways that you can stretch. Remembering that hamstrings are a 2-joint muscle, so you want to make sure that you are stretching both at the knee and at the hip. And then also neural mobilization. I know this is something that I feel like every time we always talk about a neural stretch, or if you just like are sitting and you extend your knee and dorsiflex your foot, you kind of feel that tension. I feel like even someone without a hamstring injury already starts to feel that tension. So that's how it shows how important that is to actually bring in some of that neural mobilization. And I feel like that's also kind of forgotten.
Oh, 100%. And I think, again, it goes back to just remembering anatomy. I think, as clinicians, if you just break things down just to basic anatomy, it makes 70% of the job a little bit easier. Remember, that sciatic nerve is running right through the hamstrings and goes, right between both, the medial and lateral group. So if there's an injury to any one of those, right, we see that scarring form, and not just within the muscle, but within the connective tissue like the fascia. Fascia is a big buzzword right now because of how important it actually is. Any dense tissue that's going to scar in there could get stuck around that nerve. Well, when you see these large movements like the hip flexion, knee extension, right, that sciatic nerve has to glide very efficiently, or if it doesn't, it produces pain. And I know clinically, I've definitely seen great results with someone who, again, you're doing a lot of your traditional stuff and they're just not, there's just something missing. The minute we added some, nerve flossing for the sciatic nerve, we saw a lot of big improvements.
And then moving into rehab, we talked about glute and core strengthening, how especially if someone is having that initial hamstring pain, that's not necessarily something you want to be targeting, but you can move up and like higher and lower on the chain. Glutes, sometimes glutes are a little bit hard to target without getting that hamstring as well. But something as simple as like glute squeezes, especially trying to get someone to do glute squeezes without recruiting that hamstring, because that's really big too.
Absolutely.
And then core strengthening, again, not just the strengthening, but also the activation and that motor control. So I usually like to start with just a TA activation, and then I'll do TA with breathing. So I'll have them inhale, exhale, hold, find their TA, and then with that TA still activated, I'll have them take a big inhale and an exhale. If they can hold that, then we progress on to things like marching. So inhale, exhale, at the end of that exhale, hold that TA, and then bring one foot off the floor, bring the other foot off the floor, and then I'll move into inhale, exhale, hold that TA, and then move into a glute bridge, where then I'm really having them focus on, hey, do your hips move side to side when you go into that glute bridge? That could mean a couple of things. It could be stemming either from the legs, and we have like an uneven leg activation, or it could mean that the TA is not firing, or at least it's not, it doesn't have endurance to sustain that activation. So we talk about how if I were going to put a cereal bowl on their stomach, I don't want them to spill it side to side, and some of that imagery, so that really they are trying to get that activation of that core beyond just like your crunches and some of that like six-pack abs.
Absolutely. And as you go into that hamstring strengthening, right, we really want to put an emphasis on that eccentric strengthening, but use your clinical judgment, right? Like if they have a grade 2, they got bruising, you're probably not going to start eccentrics right away, right? Because at the end of the day, eccentric is a big lengthening contraction. You're producing a lot of force, but lengthening the muscle, like a strain injury would be. So keep that in mind. You may have to start with isometrics or concentric movements first until their pain's decreased and their strength's getting a little bit better, their function's better. all right, let's start the light eccentric. So keep that in mind. Use your clinical judgment. You don't have to just blast them with eccentrics, right? Because then you could actually make the condition worse.
And they might not want to come back.
Exactly. So eccentrics are important, but definitely once your patient is actually able to tolerate them, that's when you're, all right, let's jump into it. And remember, like we were talking about with the Nordic hamstring curl, it's definitely recommended start single leg, right? We already know that after injury, you're going to see a bilateral difference, right? One leg's going to have less activation, one leg's going to be weaker than the other. So if we're doing bilateral exercises at first, you might be widening the gap, or you might not be changing that gap in asymmetry. So being able to, hey, let's focus on the single leg, and you don't have to just do one leg, right? You can do single leg on both legs because you do have crossover effects, but focusing on, hey, let's get in the single leg activation correct, and then we can start working on going bilateral and being able to produce even higher levels of force to get that better adaptation.
So one of the things that we like to focus on, especially, is you guys come to these talks and we want to make sure that you guys come out of this with actual actionable items to take to your clinic and take to your practice. So some hamstring exercise ideas. These are some things that I've done. These are some things that Randy's done. He's going to share some too. Some of these are eccentric, some of them are not. So the first one, starting at the top, is a hamstring stool scoot. This one's also, the fun level on this one is pretty good. I feel like this is something that I use for especially some of my athletes who I'm really trying to get them to like break the ice a little bit, try to like have some fun with rehab, or you can even do racing with this. And it's pretty simple. I do it pretty early on in my hamstring rehab. So, and you can even increase this by adding resistance, but even just starting with just a stool and having them put their heel down, drag towards, they can do one leg and do multiple steps with that one leg, or they can alternate legs. You can play around with that.
And I think like you said, the racing idea is actually a good little caveat, because obviously it does create some fun, and as long as your athletes are being safe doing it, because we know athletes can get carried away, but it also adds a speed element to it, which is very good for sports specificity, because this group has to move fast at some point. You may not be having them move fast early on, but those later ends of the rehab, you want to start training those hamstrings to be able to produce force really quickly. Like we talked about, rate of force development is decreased in those that have a previous hamstring injury. So being able to train that is huge, and being able to improve that.
Surface is also a huge thing on this. In my ATR, we have a carpet and we also have a concrete slab. So playing around with, what's more difficult. It's a little bit easier on the concrete with the wheels than it is the carpet. So if we're moving on the carpet, that might be like a secondary stage that we're working on, or something we work towards. Again, you could do single leg, you could do bilateral, you could do two legs at once. And then same with the Swiss ball on the top. So you can either do concentric or eccentric or both. So starting with that glute bridge and then moving into straight leg, rolling that ball out away from you. And then you can either lower there and then start again, or you can come back in, bring those knees up. The biggest thing about this is I find that people tend to sink their hips, and so you really want to focus on either starting with glute squeezes first, or TA activation, or both, or even just a simple glute bridge where you can really get your athlete or your patient to understand what it's like to get that straight neutral pelvis and that full hip extension, because again, we're really striving for that full hip extension in this exercise, and we want to find that optimal length. It's really, really easy to cheat this exercise. And then also playing around with arm movement. So like you can have your arms out to the side for more stability, or you can have them closer underneath you for less stability. You can have more balance. So you can play around with that as well. The bottom picture is a single leg RDL, which I'm sure a lot of you guys are familiar with. This one's really good. You can play around with even an uneven surface. You can do single leg, you can do double leg, you can do weighted.
Yes, and great exercise to start highlighting that unilateral aspect of making sure they're single leg. You get good glute activation from this, especially from a stability standpoint, because you have to remain single leg.
And balance. And the thing that I like about this is it is eccentric. So I feel like a lot of times when we're thinking about eccentric hamstring exercises, we just think about like Nordic hamstring or something along those lines that seems very daunting. Whereas I feel like an RDL, as long as you are focusing on that straight flat back, it really does get a good eccentric hamstring, and it's pretty functional.
Yes, absolutely.
You can play around with speed as well.
Yes, and another, some good ones that I like to do, a split squat, and then even progressing into your Bulgarian split squats. If you look at the motion, right, during that lowering phase, that's a great eccentric contraction for the hamstring group, especially in a hip flexion manner. So what I like to do is, as they're doing the split squat, right, I really have them focus on going down slowly, controlling that motion, getting eccentric load to it. And then as they come up, I try to have them go as fast as they want, or as fast as they can. Like, hey, explode up, because that's essentially what your hamstrings are doing in the gait, and especially the glutes as well. And then the nice thing with the Bulgarian split squat is, if you're not familiar with it, essentially it's a split squat, but instead of having both feet on the ground, your back foot's on an elevated surface. So as you go into that lowering phase, you get even more hip flexion, so you're getting a larger load on the hamstrings and the glute muscles as well. Even keeping it simple with, like, if you have a machine that has hamstring curls, right? Like, I like to do single leg hamstring curls with that, with the caveat of focusing on, hey, slow that motion, into extension, right? Let's really get those hamstrings to be eccentrically loaded. For some of my late hamstring guys, what I'll do is I'll have them go into a glute bridge and then they walk out their legs. So now you're testing that hamstring in larger knee angles.
And then lastly, one of my absolute favorite exercises is with the Bosu ball in this right side of the screen. So there's multiple ways you can do this. I like to start with a glute bridge. You can do multiple glute bridges. So let's say you do like 10 glute bridges, and then you hold at the end, just like she's doing in this picture. And then the part that makes it really good for hamstring like endurance is with that Bosu ball, with the round side down, you go ahead and dorsiflex and plantar flex your feet about 10 to 15 times. And it really gets a good burn in, again, trying to keep that glute bridge as high as you can, trying to keep that hip extension as much as you can, and then also working on those calf and posterior chain muscles.
Absolutely. So at a certain point now comes that return to play aspect. And like we said, previous injury is a big risk factor. And some of it is, improving the way we rehab by remembering to attack that motor system. But also is clinicians should have some kind of multifactorial criteria that they're using to progress through their rehab and also to return the athlete to play. And it doesn't have to be like super scientific. It doesn't have to be super intense. Just something that's organized, that here's what I'm looking at to get you to that next phase, to get you back to play. Some things that have been used, some things recommended are obviously going off of pain, right? If you're seeing a decrease in pain, hey, that's information that we can use. If you palpate the muscle, right? Are they still just as tender as they were the day they came in? Or are you starting to see like, oh, the palpation of that muscle group not producing as much pain? Going back to those, the neurodynamics, right? Looking back at neural tension, does the slump test still light them up? Right? If you're seeing improvement in that, hey, that's information, we can probably progress you. And I definitely would say utilize your functional testing, right? The single leg hop, single leg triple hop, that single leg bridge test, right? It's been used as a screening test, but it may also be used as a functional test. Hey, we're starting to see, you're having symmetrical strength endurance, or you improved that number, above that 19, right? You're now into the 20s. Hey, that's a good sign. That's a lower risk of injury. It might be also a lower risk of re-injury. So using these different tests can give you numbers to make sure they're on track with, one, the leg that's not injured, but also to see, are we starting to see improvements in their numbers as well? So definitely use these before you're returning someone to play or progressing someone to rehab. If you have them do a single leg hop or a single leg triple hop and they're still like there's still more than a 10% difference between the injured leg and the non-injured leg. They may not be ready to play, and we could be putting them at risk of getting re-injured. Of course, this isn't, functional tests aren't the end all be all. We're not saying that, it has to be like, oh, you didn't pass this one test, you're out. Right, there's going to be other decisions that come into play, but this can give you more information to talk to your student athlete, talk to your coach, talk to the parents if you have, if you're in that position where you have to, giving them that information that, hey, this is what I'm seeing, this is why we may not be able to bring you back right now, and they may be like, yeah, you're right, I need to get a little bit, stronger, I need to do this a little bit better, and that also goes back to patient-reported outcomes. A lot of literature likes to talk about it. It's become a very big thing to utilize. It's hard to do in clinical practice for sure, but it definitely gives you some valuable information. Even if you don't even have to use it consistently, like if you use it at certain time points, hey, it gives you a change from, say, where they were on week 4 and now you're week 8 and you gave them the patient-reported outcome. So utilizing some kind of system to help you return student athletes to play or patients to play or exercise can be huge in preventing that re-injury aspect.
Actually, good that you brought that up, because also I was going to bring up the fact that going back to the beginning of what we were talking about with the risk factors, are you addressing risk factors for secondary injury?
Yes. And I would also say, back to the patient-reported outcome, like anytime someone hears the word PRO, they're already immediately thinking like, oh man, this long form, that one I have to administer, I have to read it and grade it. And yes, those are out there. Obviously, they're validated. They do give you a nice score. Sometimes they, if you look at some of the questions, they can get some kind of information based on the question. But like also understanding that, I have, at my university, we have almost 600 student athletes. Like, we're not going to be able to do this all the time. So even just a pain scale, we already ask how our athletes are doing. Even if it's a pain scale from like 0 to 10, 0 to 100, or like, hey, functional, how do you feel based on 0, like, oh, you're the worst you ever felt, 100, you're feeling normal. Stuff like that, even though, okay, granted, it may not be 100% validated, but it's still something you can use, and you're talking to your patient, getting their input. And again, as we return our patients or student athletes to play, it's always important to remember, monitor that training load, right? They're coming from a time where, a lot of hamstring strain injuries, you're looking about 3 to 4 weeks, maybe 4 to 6 weeks, depending on the severity. So they're going from almost doing nothing compared to what they were doing before, and now they're like, all right, well, we're back to practice. And a lot of these athletes, we know, they want to go 100%. I'm back out there, I need to go. So let's monitor that training load. Let's ease them into their return to practice, progressing them from like, hey, here's where you're starting, and building up from there. And I think it's also important to educate, our student athletes or our patients and about the nature of a hamstring strain, and reminding them that, like, yes, you did this rehab, you got this one hamstring injury, but remember, like, you are at, they may be at a greater risk. Educating them that, hey, there's still more work to do, right? Have them stay on their maintenance program. Like, yes, you're feeling great right now, but who's to say, next month, right, you're not going to start getting some of that pain back. Hey, let's stay on a maintenance program. Let's make sure we're keeping mobile, keeping our strength where we need to. And also educating them that just because you feel some pain in your hamstring doesn't mean like, oh goodness, it's back. My hamstring strain's back. I can't do this. I've had student athletes like that who, one that stands out is he had a large history of like 3 hamstring strains, and very severe hamstring strains. And, we took the time, got him to rehab, got him back to returning to play. And like on certain hard days, he'd be like, oh, I just feel my hamstring, and it would really freak him out. Educating them that, hey, remember, this is what the state of your hamstring is right now, right? Like we were talking about those phases of healing. Your muscle now has more scarring in it. Your muscle does not function the way it was when it was completely normal, because that scar tissue it doesn't contract. It's there. So your muscle, there's going to be times it's not going to feel great, but we can work with that. So just trying to get them out of that like catastrophe phase, like, oh my goodness, I feel pain, I'm back to my injury phase, I'm hurt. No. Obviously we don't want you to feel pain, But like the fact that you're feeling some tightness or some soreness in your hamstring is not the end of the world. We can work with it. We just got to monitor it. I think is very important. And these are our references. Again, thank you so much for having us be able to present to you guys. If you have any questions, you can definitely reach out to us at our AT Corner email. That's atcornerds@gmail.com.
Thank you.